of change in the format of the today's session. I'm sure all of you have enjoyed the previous Kaun Banega MD episodes that we had. So this topic today, antimicrobials, would be in the format of Kaun Banega MD. That is, we will have questions. There are 15 questions, easiest to the difficult ones, and then we would be seeing who is on the leaderboard. Yes, Sesha, Madhuri, I am much better now. I hope you all can see as well that I'm much better than the yesterday and day before. Thank you everyone for the wishes. It really accelerated and helped in the speedy recovery. Thank you so much. So all set. Thank you so much, Bhuwana. Thank you. All of you set for today's KBMD episode. Because we have discussed antimicrobials in our free special classes before, we have had 2 sessions on pharmacology. I've had an entire course on antimicrobials where I've discussed your AKT drugs, anti-HIV, antivirals, the rest of the antimicrobials. So that is why I thought let's have this session as a KBMD episode so that it would be revision for everyone. So for our viewers who are watching this session on Facebook or YouTube, please make sure that you join us live on the Unacademy app so that you can participate in the live poll as well. I will not show you the leaderboard after every question. There are 15 questions. We will see the leaderboard after question number 1 to see who's at the top. Then we'll see after question number 5. And then after question number 10, we will see the leaderboard in all the questions. So stay tuned till the end to see who wins this episode today of our KBMD. And before I forget to tell you, we have our session tomorrow. It's live at 5, right? We are live at 5 every day for the free special class. Tomorrow we would be seeing CNS pharmacology, right? The topic for tomorrow is CNS pharmacology, 5 to 6 p.m. Everyone joined in. Can we start with the KBMD episode, antimicrobials? All the best, everyone. Here it goes. This is the first question, the easiest question in your antimicrobials. So you just have 15 seconds to answer this. Here it goes. Red man syndrome is seen with. Red man syndrome is seen with. So this is the leaderboard. Pragya is leading at position 1. Then we have Dr. Shiva, Cadbury, Sucharita and Raj. Okay, so this is the leaderboard. Pragya leading at the end of question 1. We all know red man syndrome, as the term says, patient becomes red. Why does the patient become red? Because of the histamine release. The histamine release from the mast cells leads to red man syndrome. And which drug causes this histamine release is your vancomycin. Vancomycin. How do we remember? Red man, man is van. So red man is vancomycin. It is seen with vancomycin. Alright. Which antimicrobial causes your grey baby syndrome? Which one causes grey baby syndrome? Absolutely right. It is your chloramphenicol. It is your chloramphenicol which causes grey baby syndrome, right? We have seen G and C that go together in a many mnemonics. So grey baby is seen with your chloramphenicol. Grey baby is seen. Which antimicrobial should not be given in children because they are deposited in your teeth and bones? Teeth and bones. Absolutely right. It is your tetracyclines. It is your tetracyclines. Which antimicrobial can cause serotonin syndrome? Which one can cause serotonin syndrome? Yes? Very good. So serotonin syndrome is seen with which drugs? It is seen with your MAO inhibitors. It is your MAO inhibitors. Serotonin is degraded by your MAO enzyme, monoamine oxidase. So which is a MAO inhibitor? Linezolid is your MAO inhibitor. So remember, linezolid has MAO inhibitory action. Very important question. So that was our question number 1. Pragya is leading. We'll see the next leaderboard after the 5th question. Till then, let us move to the next question here. Here it goes. Which of the following is a reverse transcriptase inhibitor? Which is a reverse transcriptase inhibitor? So easy questions, you would have 15 seconds to answer it. Difficult questions, you would have 30 seconds to answer it. So 47% only have got this right. All right. Now these are your anti-HIV drugs. We have discussed in detail in a plus course that your drugs which are ending in navir, those are your protease inhibitors. Those are your protease inhibitors, right? So your ritonavir, indinavir, atazanavir, all of these, nelfinavir, all of these are your protease inhibitors. Abacavir is your reverse transcriptase inhibitor. It is your reverse transcriptase inhibitor. Yes, it is your NRTI. What does N stand for? Nucleoside reverse transcriptase inhibitor. Which HIV drug is your nucleotide reverse transcriptase inhibitor? We all know nucleotide T is tenofovir. Tenofovir is your nucleotide reverse transcriptase inhibitor. So please remember this, abacavir is your reverse transcriptase inhibitor. It is your reverse transcriptase inhibitor. Alright, let's go to the next question. Next question, here it is. So starting with the easy ones, but I know this is a confusing topic. Which of the following does not bind to 50S subunit? Which of the following does not bind to 50S subunit? So all the viewers on YouTube and Facebook, I have posted the link there in the chat to join in our class. You can join us on the live leaderboard and see your preparation, assess your preparation. So 36% only have got this right. So guys, this is like a must know subtopic in your antimicrobials. Which ones bind to 30S? Which ones bind to 50S? Absolutely right, Saranya. Very good, Priya. So do not get confused here. We know the mnemonic is buy at 30 and sell at 50. It could be sell SELL or it could be CELL. So sell at 50. Buy at 30 and you sell at 50. Now this at 30, so this is the ones which bind to your 30S subunit. So that is your aminoglycosides and tetracycline. Aminoglycosides and tetracycline. Sell at 50, so it is your cells at 50. Remember, the S here is your streptogrammin, not streptomycin. So I think many of you made a mistake there. Remember, it is streptogrammin and not streptomycin. Then you have erythromycin or your macrolides. You have lincosamide, clindamycin. You have linezolid and you have your, the other C is your chloramphenicol, alright. So streptomycin is an aminoglycoside, so it binds to your 30S. Chloramphenicol, erythromycin 50S, linezolid binds to your 23S subunit. It inhibits the protein synthesis initiation. This works on initiation, it inhibits the initiation. Rest of them, they are basically acting on your elongation. So remember, linezolid is on 23S subunit of 50S. It prevents the formation of 70S ribosome. So remember, streptomycin is 30S, streptogrammin is your 50S. Clear with everyone? So what is the mnemonic to remember? Buy at 30 and sells at 50. Sells at 50. Alright. The S here is streptogrammin. Alright. Let's go to the next one. So before I go to the next one, this is a quick review. The diagram which tells you 50S पे कौन से bind होते हैं. 50S पे we said it is cells. So you have streptogrammin, that is quinupristin, dalfopristin, macrolides, that is your erythro, azithro, clarithrol. Then you have linezolid, lincosamide, clindamycin, and you have chloramphenicol. 30S are all your aminoglycosides. Tigecycline, someone has mentioned, it is also at 30s, and your tetracyclines, all of these are at 30s. All right. All the best for the next question. We'll see the leaderboard after question number 5. This is your question number 4 here. Which of the following bactericidal drug acts by inhibiting protein synthesis? Which of the following bactericidal drug acts by inhibiting protein synthesis? So I can see only 28% students getting this right. So what do you think? Which is the first option to be ruled out here? Only 28% have got this right. Which is the first option? Very good, Medico. Very good. It is the vancomycin, which is the first option to be ruled out here because it inhibits the cell wall synthesis. It inhibits the cell wall synthesis. It is not a protein synthesis inhibitor. So for the 13% who marked B as the option, which are the drugs which act by inhibiting cell wall synthesis? Which are the drugs which act by inhibiting cell wall synthesis? We have seen the story mnemonic. What is that? A beta, that is a son, we know is very demanding and demands for all the vehicles from the father. Which all vehicles does he demand from? पहले बोलता है साइकिल चाहिए, फिर बोलते हैं वैन चाहिए, फिर बोलते हैं नहीं हमको फोर्ड चाहिए, and फिर then they say we want the bus. You know the biggest one, we want the bus. So what does that mean? Your beta lactams, your cycloserine, van is your vancomycin, Ford is your phosphomycin, and bus is your bacitracin. So remember the story, cell wall synthesis inhibitors, beta demanding for all the vehicles, cycle, van, Ford and bus. So you have beta lactams which include your penicillin, cephalosporin, cycloserine, vancomycin, phosphomycin and bacitracin. So vancomycin is a cell wall synthesis inhibitor and not protein synthesis inhibitors. In your protein synthesis inhibitors, all are bacteriostatic except for two groups of drugs. Which are the two groups which are protein synthesis inhibitors and are bactericidal? Absolutely right. One is aminoglycoside and the other one is streptogramins. Aminoglycoside and streptogramins are the only protein synthesis inhibitors which are bactericidal. Rest of them are your bacteriostatic. So gentamicin is an aminoglycoside and that is why this is the answer. Okay. Tetracycline, it binds where? 30S subunit. Protein synthesis inhibitor, but it is bacteriostatic. Linezolid binds to 23S or 50S and it is bacteriostatic. At higher concentration, linezolid can be bactericidal to some organisms, but predominantly remember it is bacteriostatic. Okay, so you have the better option here, gentamicin, to go with. Clear with everyone? That is your question number 4. Get ready for question number 5. We'll see the leaderboard at the end of question number 5. So this is the question for your rank 10K. An easy one. Which of the following is not effective against anaerobes? Which of the following is not effective against anaerobes? So very good, 45% of you are getting it right. So this is question number 5 and we'll see the leaderboard. Okay, so now who's leading is Neha. At the first question we saw Pragya was leading, now it is Neha. Then it is Umam and Balraj, Prabhakar and Bushra. Govind, amazing. Glad to see you on the leaderboard. So we know the answer to this question is amikacin. Absolutely right. Please remember in this antimicrobials, very important point, the 50% students who got it wrong, that aminoglycosides, they need oxygen for their activation. They need oxygen for their activation. So therefore, they are not active against your anaerobes. Please remember this point. They are not active against anaerobes. So remember, aminoglycoside, they have no activity. Aminoglycoside, no activity against anaerobes. So amino say anaerobes no. Anaerobes no are your aminoglycosides. Okay. And aminoglycosides are always given orally or parenterally. How are aminoglycosides given? Oral or parenteral? They are always given parenteral. They are not given orally. They are highly ionizing, not absorbed from the GIT. So that is the reason if they ask you a question, which AKT drug is not given orally? Rifampicin, ethambutol, pyrazinamide. What will be the answer? Which AKT drug is not given orally? Streptomycin. Streptomycin is the one which is not given orally, not to be given in pregnancy also. It can cause ototoxicity, right? Aminoglycosides per se are nephrotoxic. So remember this, it is given parenterally. So Neha is leading at the end of 5th question. We'll see the leaderboard again at the end of 10th question. All the best everyone. Here is your next question. Before I go to the next question, for anaerobes, at least remember it was asked in a recent exam also. Anaerobic infections above the diaphragm and below the diaphragm. So let us say above the diaphragm, lung abscess caused by anaerobes. What drug do we give? Clindamycin. What do we give for below? Abdominal mein abscess hua, anaerobic. What do we give below the diaphragm? We give metronidazole. We give metronidazole. So anaerobic organisms, remember Bacteroides fragilis, Clostridium. These are your anaerobic organisms, right? These are your anaerobic organisms. Clindamycin and metronidazole are given for anaerobes. Which of these two drugs which of these drugs cause your pseudomembranous colitis? Clindamycin or metro? Clindamycin causes your pseudomembranous colitis. Metronidazole is used in the treatment. Metronidazole is used in the treatment of your pseudomembranous colitis. Okay. Next question. Here it is on antifungals. Here it is on antifungals. Starting a poll for all of you. Incorrect match regarding the mechanism of action of antifungals. Very good. So 53% have got it right. So 52% have got it right. Now what is incorrect in this statement is your option B. Is your option B. Very easy. Flucytosine inhibits lanosterol to ergosterol? No. Flucytosine, as the term says, it is cytosine. Anti-cancer drugs also, we have read, your anti-cancer drugs which are anti-metabolites, which act as anti-metabolites, right? These are the drugs which mimic your nucleotides, basically, right? So when you see the term flucytosine, cytosine is present in your nucleic acid. So this flucytosine will basically inhibit your nucleic acid synthesis. So that is why it is not flucytosine, the one which inhibits lanosterol to ergosterol. The one which inhibits your lanosterol to ergosterol conversion are your which drugs? Azoles, basically fluconazole. Basically जो azole वाले drug होते हैं, they convert your lanosterol to ergosterol. So how do we remember that is Azole drugs, LE, the LE in the end helps you to remember it converts lanosterol to ergosterol. So remember your fluconazole is an example of a drug which inhibits conversion of lanosterol to ergosterol. So rest of them automatically become the correct statement. A frequently asked question, which drug acts by pore formation in the membrane? It is your amphotericin. Right, so amphotericin can cause the pore formation in the cell membrane. Yes, nystatin too, but nystatin is very nephrotoxic. That is why it is not given for systemic use. Even amphotericin is systemic nephrotoxic, but remember nystatin is not generally used. Amphotericin inhibits beta D glucan synthesis, is your anidulafungin. ठीक है, तो ग्लूकान सिंथेसिस, डी ग्लूकान सिंथेसिस is your anidulafungin. So that is your D glucan synthesis. So D and your ULA helps you to remember it is your anidulafungin. So anidula does D glucan synthesis inhibition. Terbinafine inhibits squalene epoxidase. It inhibits your squalene to lanosterol conversion. That is your terbinafine. Let me show you the image here. So this is the image where you have here squalene to lanosterol. So basically squalene epoxidase is inhibited by your terbinafine. So again you can remember from terbinafine. Terbinafine is inhibiting your squalene. It is inhibiting your squalene epoxidase. Okay. Lanosterol to be converted to ergosterol, L2E, is inhibited by your azoles. Flucytosine. Cytosine is present in the nucleic acid. So basically it inhibits your nucleic acid synthesis. Griseofulvin, very, very important. It acts on your microtubules. It acts on your microtubules. Griseofulvin. Then you have polyenes, amphotericin, which cause pore formation. Pore formation is by your amphotericin or by your polyenes. Clear with everyone? Griseofulvin, very, very important to remember. It has increased absorption when given with fatty meals. Absolutely right. So remember griseofulvin, grease matlab fat, oil. So it increases the absorption with fatty meals. Okay, it increases with fatty meals. So that is about your antifungals. All right. So mechanism of action dekha hai. Not going into the details, of course, of the topic. Okay. So we are at question number 6. So again a reminder for my Facebook and YouTube viewers. So